The Vince Lombardi Cancer Foundation, and of course our team here at Emplify Health by Bellin. They will share reflections on the impact this partnership has had, now in its 9th year, which is pretty incredible, and how we are working together in the fight against cancer. We do look forward to offering a limited media tour at the conclusion of formal remarks, and I'll provide some more details on that in just a few minutes. But until then, to kick things off, it is now my pleasure to welcome Packers Director of Public Affairs, Aaron Popke.
Thank you, Kelly, and good morning, everyone. Thanks for being here today. We're excited to be kicking off our 9th year of Packers vs. Cancer campaign here at the cancer team at Emplify Health by Bellin. We've been really pleased with how this campaign has made an impact over the years. After raising awareness for breast cancer since 2009, along with the NFL, we launched Packers vs. Cancer back in 2017 to focus on all forms of cancer and show support for those who've been affected. We're glad to be working again with our healthcare partner, Emplify Health by Bellin, on this initiative. They know firsthand how cancer impacts many people and families in our community. We're thankful to have their support in this program, and we're proud to be highlighting one of their cancer treatment facilities with today's announcement. This year's Packers vs. Cancer's game, presented by Emplify Health by Bellin, will be on October 12th against Cincinnati Bengals. We'll be honoring cancer survivors during the game and through a variety of game day entertainment pieces. We're also excited for our players to pay some special visits to patients in the hospital in this facility, starting today here with the cancer team. Defensive lineman James Esther is here to tour the facility and greet patients. And we're fortunate to have James here today to share his experience with cancer. We always appreciate hearing from our players on these topics since cancer touches all of us. Many of our fans have fought cancer themselves or supported a loved one through the disease, and we know our players can relate. Another critical component of Packers vs. Cancer is raising funds for research and cancer care. We're proud to be raising funds to benefit the Vince Lombardi Cancer Foundation, fittingly named after the legendary coach. The foundation funds advancements in cancer research and compassionate care. We're raising funds in a number of ways, and we're inviting all our fans to take part. We're proud to introduce the new Packers vs. Cancer hat, which is available now in the Pro Shop, and it's a green striped New Era knit hat with the Packers logo on the front and the Packers vs. Cancer logo embroidered on the side. Since we know the colder weather is coming later this fall, not yet, certainly not today, but later this fall, we hope fans will wear it again and join us in supporting the fight against cancer. Again this year, $5 from each hat sold in the Packers Pro Shop, both in the store and online, will be donated directly to the Vince Lombardi Cancer Foundation. For fans who want to contribute directly to the effort, they can shop at the Pro Shop at Lambeau Field now through the month of October and choose to add $1 or more to every purchase. Their donations will benefit the Vince Lombardi Cancer Foundation and will be matching up to $10,000 of the donations. Also this year, we'll have our Packers vs. Cancer high school football game at Notre Dame Academy on Friday, September 26th. They'll be taking on Menasha that evening. We'll have several of our players there also to participate. We encourage everyone to come out and join us at the game to enjoy some high school football and be part of Packers vs. Cancer. And if you're not able to make it to the game in person, you of course can join from afar by watching the game on local TV 32 WACY. And thanks again to Dr. Rathgaber and the Emplify Health by Bellin team and their staff, and to Anne-Marie Moss and Jen McDonald for the Vince Lombardi Cancer Foundation and the team there for their support of the initiative. Thank you to Kathy Dworak and our entire community outreach staff. They work hard each year to help those affected by cancer in many different ways. And thank you to Craig Benzel and everyone on our sales team as well for their work on the campaign. Also, Gabrielle Dow and Krista Jorgensen and their teams, including the Packers Pro Shop, for their work on creating the Packers vs. Cancer donation option and, of course, the new hat. Lots of teammates at the Packers contributing to this effort. And we're hoping to see a lot of people showing their support for those affected by cancer and proudly wearing their Packers versus Cancer hats at our next home game and throughout October. Thanks again for coming.
Thank you, Aaron, and of course, thanks to the entire Packers organization. As you indicated, it truly is a team effort, and we so appreciate your partnership. And we will have that hat available to show our media partners at the conclusion of the news conference as well. So next up, it is my pleasure to welcome another teammate in Packers versus Cancer, somebody who's passionate about screening and prevention. He is Emplify Health by Bellin family physician, Dr. Austin Greenwood.
All right. Well, thank you very much for having me and for welcoming me here today. As mentioned, I'm Dr. Austin Greenwood, and I'm a family medicine physician with Emplify Health by Bellin. I have the privilege of taking care of patients over at the Bellevue Clinic on the opposite side of town. I'm really grateful to be here so that way we can spread the word and get more information of the power of prevention and screening for cancers. And I'd like to thank the Vince Lombardi Cancer Foundation and the Green Bay Packers for this partnership so that way we can make that word more pronounced here today. As a family medicine physician, I get the opportunity to take care of people through a lot of different situations in their lives. Sometimes it's a happy situation, a lot of times it's routine, sometimes it can be very difficult. One of the most difficult and one that still doesn't get easier over time is when you have to tell someone they have or may have cancer. It becomes even more challenging when we have something that could have been detected earlier through one of our screening measures. That's why I'm here today, so that way we can talk about why don't people get screened for cancer, and more importantly, what can we do to improve that outcome. The first that I'd like to bring up is time, something we all probably could afford a little bit more of if we could. Unfortunately, life gets busy. We often put off our appointments or put off our screening. We say we can take care of it next year. If I can impart any piece of wisdom today, it's that time matters. According to the American Cancer Association, colorectal cancer, when found early, has a 90% 5-year survival rate. But unfortunately, only 40% of cancers are found at this early stage. So if there's one message, again, that I can emphasize is don't wait. Make these appointments, get your screenings done, because time can really make a difference. The second that I'd like to bring up is fear. I hear this brought up a lot at my office. Fear comes from the fear of a diagnosis, the fear of the word cancer, fear of what that means for you, your family, and your future. It's understandable and it's very normal. We can't make fear go away, but we can be there by your side like any good teammate is to face it when it does arise. And if we can talk about the truth, most often when we do screen for cancer, it brings peace of mind. No matter what, though, that test comes back with, we will always be there with you to help guide you and bring you the next steps in whatever your treatment may be. Lastly, people often don't know what screenings they should get or why or when they should get them. Now, it's really confusing. There are a lot of screening guidelines out there, and they change based on your age, your family history, or risk factors that you might have. They also change throughout time as new data becomes available and we can make updates to those recommendations. That's where having a primary care physician is critical. Think of us as your coach, someone that you can go to who has a game plan for you to make sure you get the right screenings done at the right time. So, which cancers can we screen for? We can't screen for everything, unfortunately, but there are 5 in particular that we have good screening tests for and have treatments that we can use to help have better outcomes. Skin cancer, lung cancer, colorectal cancer, breast cancer, and cervical cancer. Today, I'd like to spend some time talking about cervical cancer as we're seeing national statistics that are a little bit concerning. Over the past 20 years, we have found that there has been a decrease in the number of eligible women getting their cervical cancer screening done. That number is about 75% of eligible women in 2023, and we're seeing the same changes here at Emplify Health by Bellin. There's good news, though. We have tools that work not only in screening, but in prevention of cervical cancer. The HPV vaccine has dramatically reduced cervical cancer cases across the country, and it's the only vaccine that's been proven to prevent cancer. While screening is still critical, HPV vaccination gives us something that's even better, the chance to stop cancer before it even starts. To the parents of our adolescents out there, this message is directed to you. We recommend HPV screening at ages 11 and 12. This can be a little uncomfortable to talk about because HPV is a sexually transmitted infection. But I promise you that while this is uncomfortable, I want to make it clear it's not about encouraging sexual activity or implying your child may be sexually active anytime in the near future, but it's about protecting your child's future. We vaccinate against a lot of things, and we treat and screen for a lot of things with the idea that we catch it and treat it well before any concern could come into play, well before it starts. It's not about sex, it's about preventing cancer. So, with all that in mind, I'd like to leave you with one simple but powerful message. Screening saves lives. Don't let time, fear, or uncertainty of what you should do stop you from getting the appropriate screenings. Don't try and figure it out on your own either. That's what we're here for. Talk to your primary care physician. If you don't have a primary care physician, give us a call. You can reach us at 920-433-3500 to schedule an appointment, or go online to bellin.org to get in touch with a primary care physician. And finally, I'd like to thank again the Vince Lombardi Cancer Foundation and the Green Bay Packers for this incredible partnership. Preventing and fighting cancer is truly a team effort, and together we can make a real difference. Thank you very much.
Thank you, Dr. Greenwood, for being here, for sharing this important message about prevention, and for all you do for our patients each and every day. It is now my pleasure to introduce another valued partner in the Packers vs. Cancer Partnership. Here on behalf of the Vince Lombardi Cancer Foundation is board member and Medical Advisory Committee Chair, Jen McDonald.
Well, good morning, everybody. I'm proud to serve as board member and medical advisory chair for the Vince Lombardi Cancer Foundation, as well as senior vice president at Emplify Health by Bellin. The Vince Lombardi Cancer Foundation is deeply grateful for the continued partnership with the Green Bay Packers and Emplify Health. Together, we're raising awareness about the life-saving importance of cancer screening and early detection. We encourage everyone to have a conversation with their primary care provider about their personal risk factors and which screenings may be right for them. Early detection is key, and it allows for more effective treatment of screenable cancers. Coach Vince Lombardi's story reminds us of why this work is so important. 55 years ago, preventative screening might have changed his outcome. Just 10 years after his diagnosis of colon cancer, Coach Lombardi passed away at the age of 57. Thanks to events and campaigns like the Packers vs. Cancer, the Vince Lombardi Cancer Foundation has raised nearly $25 million to support cancer patients, fund prevention programs, and advance research toward innovative treatments and cures. In recent years, we have used proceeds from the campaign and other generous donations to help fund research aimed at slowing or stopping the spread of pancreatic cancer, exercise rehabilitation programs for cancer patients and survivors, and patient navigation services to provide support to newly diagnosed patients as they begin their treatment journey. Packers fans can go and support this mission by purchasing the exclusive Packers vs. Cancer hat. $5 from each purchase goes directly to the foundation. You can also buy them in-store and online at the Packers Pro Shop. Throughout October, Pro Shop visitors can also donate $1 or more to the foundation, and the Packers are generously matching this donation up to $10,000. This is truly a team effort. We are so grateful for the strong partnership of the Green Bay Packers and Emplify Health, and especially appreciative of all of our fans whose purchases and donations make this campaign such a success. You are vital partners in this mission. We prevent cancer, we provide best possible care to our patients, and ultimately our goal is to provide a cure. Thank you.
Thank you, Jen, and again, thank you to the Vince Lombardi Cancer Foundation for all that you do. So I now have the distinct pleasure of introducing this year's Packer player spokesman, here to share a bit about how cancer has touched him and his life. I'm pleased to welcome Packers defensive tackle, James Esther.
Good morning. First and foremost, I just want to say it's a blessing to be here and be able to speak on behalf of my team and on behalf of this organization. Like we've spoken about a little bit today, cancer affects almost all of us. For me, the first time that cancer affected my life, was with my best friend, Ananda Bell. At a very young age, she was diagnosed with brain cancer, and obviously being diagnosed with any form of cancer is terrifying for an adult. So just imagining that for a child is just almost unbearable. Luckily, she had a very good support system. My family and I, we always made sure to go and visit her after school and try and keep her feeling the best possible way she could. Obviously, anyone who's dealt with a family member or a loved one experiencing something like that, it hurts to see them deteriorate, and it hurts to see them kind of lose what they once were. But like I said, cancer has touched all of us, and so it's important to spread the awareness, spread the knowledge of screening, like we kind of spoke about earlier, and just continue to do the best we can, whether you're someone who's been personally affected or whether you're not. I think that as a member of the Packers, as a player in the NFL, I think that it's our duty to continue to support causes like these, given that we have such a platform. So I just want to say thank you, and I want to thank you guys for this partnership and just continue to spread the awareness and allowing me to have a say-so today. So I appreciate you guys.
James, thank you so much for being here, for sharing your story. It truly does make an impact, and we appreciate you so much. This concludes our formal remarks. I'd sincerely like to thank everybody for joining us here today. We will be offering a brief facility tour kicking off at about 11:30 with James, and we'll also be able to share some images of the hat, which we're eagerly waiting to showcase. We do ask that for members of the news media that you have one person from each outlet attend that tour, just due to space constraints, but we will have some great opportunities for B-roll and to capture some of those interactions. I know our patients are eagerly awaiting it. In the meantime, our speakers would be happy to take questions here at the podium or in one-on-one interviews after the fact, and again, we'll be able to show you this year's hat. So I want to thank you all for being here. Are there any questions while we're at the podium? All right, hearing none, let us know how we can help you after the fact. Aaron.
I will ask James to come up.
There you go.
And